West Africa is currently grappling with a deadly virus called Ebola. Many people may have contracted it due to lack of information. The most important thing to note here is that Ebola is not airborne. One will not likely catch the virus just by nearing someone who has it. Instead, the virus spreads through direct contact with bodily fluids. For example, Ebola can be transmitted if the blood or saliva of an infected person gets into another person's eyes, nose, or mouth. The virus can survive on surfaces, so a person may catch it if he comes in direct contact with an object contaminated with infected secretions, such as needles. The Centers for Disease Control and Prevention says typical symptoms include fever, headache, muscle aches, weakness, diarrhea, stomach pain, and lack of appetite, while some may experience other symptoms like rashes, cough, sore throat, chest pain, and internal-external bleeding. Symptoms usually appear 8 to 10 days after exposure, and since there is no vaccine for Ebola as of yet, all physicians can do right now is to maintain blood pressure and treat other infections that come along due to the patient's weak bodies. But of course, prevention is still better than cure, so be sure not to come in direct contact with an infected person or the body of a diseased patient. It also helps to wear protective clothing like masks, gloves, gowns, and even goggles.